Autism has a wide range of severity, which falls under the umbrella of autism spectrum disorders, which affect social skills and behavior. The disorders can be defined as a group of neurological disorders characterized by social communication impairments as well as the presence of stereotyped and repetitive behaviors and interests. One in every 88 children are diagnosed with autism spectrum disorder.
Children with ASDs are slow in developing social, emotional, and language skills. They have trouble responding to emotional or social interactions, making eye contact, adapting to change in routine or rituals, creating deep relationships, and taking turns. Symptoms also include repetitive behaviors such as shaking arms, twisting body, and fidgeting. So, how do we treat this disorder? How can we reduce the strength of these symptoms? Well, because symptoms associated with ASDs affect multiple areas of functioning, there is a need for development of a multi-system therapy approach. And this approach could be music therapy. It has been proven that children with ASDs have a strong ability to pick up on tone, pitch, tempo, and emotion in music. They struggle to figure out emotion through facial expression, yet the children can use musical elements to determine these feelings. Music therapy takes many forms and can be approached in several ways by the therapists. The type of music therapy a child with autism undergoes depends on what symptoms exist and how bad they are. Music therapists believe that music fosters the imaginative play of the child. It is a relational therapy, so treatment relies on the therapeutic relationship developed between the patient and the therapist. In an experiment designed to figure out what within the therapy causes reduction of symptoms, all the credit went to the client-patient relationship and the therapist's ability to respond to the patient's actions. It is important that during the music therapy sessions, clients are actively singing, dancing, playing an instrument, and listening to the music provided by the therapist. There are two options for therapy: individual or group. In the one-on-one setting, therapy is more individualized and flexible. Therapists adapt and react to the patients and the patient's goals. This is known as improvisational music therapy. These therapists are trained to sing and play music with the patient while attuning and adapting to the child's behavior. A major contributor to the success of individual therapy is musical attunement. Musical attunement is adjusting the pitch, tempo, or tone of the music to match the patient's emotions, behaviors, and movements. The goal is for the child to better associate the emotion conveyed in the song with the situation occurring while they play with toys. An example of this is the therapist singing in a sad tone when an action figure gets hurt, or in a happy tone when a doll receives a gift. Attunement opens up opportunities for the child to respond and relate. Researcher Epstein and colleagues found an increase in participation and engagement when they sang songs that were familiar to the child and pause at the end of lines. The client would fill in the last word in the line, which improved their anticipation skills. For example, the therapist would sing, "Old MacDonald had a," and then the child would sing, "farm." Group therapy sessions provide a platform for children with ASD to comfortably interact and engage with peers. It provides opportunities to make social connections. Within the group platform, there is a focus on imitating, which fosters turn-taking, social exchange, joint attention, and shared emotion. Lack of self-control is a challenge unique to children with autism. Dyadic drum playing in groups or pairs is one tactic used to encourage intentional engagement and intentional gestures. Dyadic drum playing is essentially synchronizing movements and beats among or between group members. The children simulate joint attention and anticipation while partaking in this exercise. Music therapy makes up 12% of all autism treatments and 45% of all alternate treatment strategies used within the school setting. A newly developed method, Creatively Able, is strategically developed to reduce symptoms of ASDs through storytelling with music and dance that keeps a simple and steady 4-count beat. The multi-system approach utilizes group performances to encourage children with ASDs to engage in social interaction, creativity, and self-expression. Why should anyone consider music therapy? For one, children are more willing to participate in
in therapies when they have fun and are not nervous. But also, music and speaking are similar in structures, so transitioning between learning songs and talking is easy. Therapy through rhythm targets a specific social skill, such as selective attention, which is developed and translated into non-musical interactions. A study conducted by A. Blythe Lagasse and colleagues showed that after children with ASDs underwent music therapy, they had more organized brain activity and higher scores on the behavioral test. Laura Brown conducted a study which found that autistic children can at least identify between sad and happy tunes with high accuracy, although sad seemed to be more easily identifiable. Remember that new type of intervention introduced earlier called Creatively Able? After partaking in the intervention, children showed significant reduction in compulsive and stereotyped behaviors. Those are the repetitive behaviors like rocking and fidgeting. In many studies, these 5 in particular, data was collected through parent surveys on their analysis of their child's change in behavior. These are the most effective form of determining generalizability of results. Parents know their kids best, right? They would be the best judges of behavior and social changes. So far, parents believe music therapy is effective and worth trying. The results are not always immediate, but parents generally notice the increase in social skills and motor coordination. The therapy does not work the same for every child, and it may not be any more effective than standard care. In Bielenick's study, there were clients who noticed no improvements over the course of the therapy. The results of each study can be different based on context of social interactions and severity of symptoms. Statistics could also change based on age and experience. Current studies overall have poor quality due to the small sample size and lack of control groups. Additionally, Spiro and Himberg confirmed that the therapists used in each study, although the same throughout, cannot be considered constants due to the lack of procedure, pattern, and continuity between sessions. However, the studies done suggest that music could be an avenue for a long list of improved symptoms that include but are not limited to emotional understanding and regulation. There is evidence supporting high efficacy in music therapy, but it is not definitive. We want to encourage more research to be done due to the promising evidence that already exists today.